The impact of choosing an inexperienced doctor for dental implants can be so profound. For over 20 years, we've set the standard for expert dental implant surgery and prosthodontics, restoring confidence and beautiful smiles. Each week, we delve into why expertise matters, providing essential insights to answering your questions. Join us to learn how to avoid the common pitfalls and ensure the best outcome for your dental health. Let's begin. Good morning, everybody. Dr. John Willardsen here with Memo Gea, and we've got a great show for you today. Sorry, we're running a little bit behind. We've got a lot of great things that are happening behind the scenes, and sometimes we get distracted and have to juggle all of the things that we're managing. But all good things happening for us, and we apologize for being late. But again, like I said, we've got a great show for you guys. Great live stream. First of all, we'd like to kind of check in. Last week we shared basically kind of a spiritual thought to lift, to kind of start off with some good vibes, I guess. And the other day we were at the mall, and there was kind of a couple there, and the clothing that they were wearing, I could tell was, and not to bring in darkness, but just to kind of separate. Nowadays there's no gray areas anymore. It's either dark or light. And this couple, they both had T-shirts on, and you could tell that they were basically T-shirts, satanic type T-shirts, and I just kind of felt, for one, I don't understand that. I can't relate with it. But what came to my mind was not so much what it represents, but it's the dark versus the light. And we need light in our lives. We need to have things that uplift us, things that bring light to us, and it's only through our Savior Jesus Christ that light can be brought. I don't care if it's material things, I don't care if it's whether it's money, even so many things that come at us in our lives, but nothing can bring us the same type of light that one truth and also our Savior Jesus Christ can bring. So I'd like to read a scripture around this, and it says, "And the light which shineth, which giveth you light, is through him who enlighteneth your eyes, which is the same light that quickeneth your understanding." So that same light that we have, each of us have in our eyes, and if we go in and delve into things that diminish that light, whatever it may be, things that can suppress our spirit, that light, it's diminished. And we can see it in people's eyes as they, maybe are making choices that cause their own light to be suppressed. So again, it says, "And the light which shineth, which giveth you light, is through him who enlighteneth your eyes, which is the same light that quickeneth your understanding." And it also helps us quicken our understanding. It helps us understand, how God works in our lives. And when he talks about it is through him. Him obviously is our Savior Jesus Christ. And then it says, "Which light proceedeth forth from the presence of God to fill the immensity of space." So, the immensity of space on the earth, outside the earth, is filled with the light of God, and it's filled with that light. And the last verse says, the light which is in all things, which giveth life to all things, which is the law by which all things are governed, even the power of God, who sitteth upon his throne, who is in the bosom of eternity, who is in the midst of all things. And I love this scripture because it really encompasses so many aspects that a lot of times we can't comprehend. We know that when the sun comes up, there's light, and when it goes down, it's dark. We know that bad things happen usually when it's dark. People kind of get into mischief when the sun goes down. But more importantly, we can draw in to our souls, into our minds, into our eyes, things of good, things of light. And these things, as we draw in more light, our understanding and our quickening of understanding grows. So as we choose to do things that draw in more light, I don't care whether it's praying, whether it's thinking about God, whether it's praying to God, whether it's reading scriptures, whether it's doing something kind for somebody else who may be down on their luck. There are so many things that we can do to help draw in that light. And ultimately, as we do that, the more and more we become accustomed to drawing that light into our souls, into our eyes, into our hearts, the happier we're going to be, because we will find the light, because that light is the love of God, and that love of God is what really gives us the peace and the joy that we're able to find as we live a life of purpose, live a life that is filled with the light of God. So just wanted to share that scripture with you all, and if you have any comments on it, feel free to comment in the comment section. But there's so much that we can learn. There's so much that we don't know. There's so much I don't know. But the more I do learn and study and grow in the gospel of Christ, the more I understand the world around me, and the more we see how desperately we need this in our lives. So anyways, Memo, how was your week? Or any good thoughts on any?
No, that's good. You're right about all that. And I feel like going along to what you just said, kind of like what we talked about last week, tying it to all the to-dos to have a better life, just overall. There's just so much to do. And I feel like with what you just talked about, it's kind of the same, right? Like the more you try to draw closer to God, right? It's like, man, there's so much to do. But you just simply start with, just like you said, building the habit of just praying, right?
Right.
Like just make that a habit, and even just that, you'll see the difference in your life as you continue to do it. And then once that's a habit, then you can make other things a habit that will draw you closer to Him, or that, like you said, like radiate good.
Absolutely.
Right?
Yeah.
So, no, I completely agree with you. And I feel like you notice it throughout your day. You notice it throughout like your weeks, right? So I agree. I've had a great week. They're always great, but
yeah, especially like starting today late. Oftentimes we get, and I know all of us do. We get inundated. We get overwhelmed. We feel like, how in the world are we going to pull this off? How are we going to do this? But I also feel like if we can turn towards what we know to be true and kind of set aside, because the world comes at us fast, it comes at us hard. When the bills come in, they've got to be paid. When, in my case, when patients need something, it's got to be done right then and there. That is just part of life. And a lot of times we need to be able to rely on something other than ourselves, which we talked about as well last week. And the more we can develop faith, and the more we can develop that relationship with God, and learn how to depend on Him and how to call upon Him, and then more importantly, how to recognize it. And once we do see these little glimmers of help or hope, and then recognize those things, that's really important, because we recognize it once and we have gratitude for it, and then again we see it, and so on and so forth. Which kind of leads me into my next, my case here of the week. So,
Doctor, before the case of the week, I do have a few questions from last week's live stream.
Yeah.
Because we talked about the Trust Aesthetics, the RF Microneedling.
Yes, we're super excited about.
Yes, we are. And, you mentioned the radio frequency microneedling. So we have 3 questions. One of them is, how long are the treatments and what is the prep needed before and after going through it? Okay.
That's a great question. So what is RF microneedling? So, as we evolve as human beings, as we evolve, what we want to cling to is our youth, right? We want to cling to, at least, I want to kind of look like I did when I was 25 or 30 years old, but as time goes on and as I spend time in the sun, and this I think applies for everybody, but we would like to have the appearance maintain relatively the same as we did in our youth. And today we have technologies that will reverse the clock and reverse the aging clock, both in our diets and in how we what we ingest, what we take into our bodies, hydration, exercise. There's so many things that we can do to try to help reverse the aging process. But then when it comes to our skin and to our the aesthetic, overall aesthetics of our facial aesthetics, we'll say, all right, what the RF microneedling does. So, and there's Botox, there's lasers, there's lots of different types of treatments that can be done in order to help reverse the clock. And so here at Trust Aesthetics, we have adopted the Silphermex, which is RF microneedling. So it's radio frequency microneedling. And what that means is let me see if I can go. I may have to go back to last week's live stream because I'd have to pull up a well, here's the device. So this is the Silphermex. And what microneedling is the it basically punctures holes in the skin, and what the RF stands for is radio frequency. So you're getting energy pulsations and energy emitted into subdermally, so into the through the epidermis, so the skin, and then into the dermis. And what that does is that heat helps retract the tissues down there so that it tightens the skin, and it also helps form collagen, so collagen formation, which is what gives us that natural glow. Whereas if you don't do anything, like if you don't do any sort of treatment, you don't do, and the other thing we do RF microneedling, we do the DECA SmartSide Pro, which is it's a very superficial laser to take care of any dark spots, brown spots, red spots. We have IPL. We've got a lot of different modalities that we can use to help really reverse the clock. And the reason that we have gotten into this, one, aesthetics is such a huge part of our practice. When we do a major dental reconstruction and we take a patient who, let me go back to my photos if I can find them. got a lot of stuff on my screen here. So, if we go back to...
Doctor.
Yeah.
Is there a difference between radio frequency microneedling and regular microneedling?
Yes, that's a great question. So
let me just tell you why I have this question.
Mm-hmm.
Anything I looked up online, I'm just trying to help viewers understand what the difference is, because regular microneedling, one session is a lot lower in price compared to radio frequency, because they don't really understand that. But once they do, and that it's like FDA approved and all that, then,
Right.
then that's when.
Yeah, so let's talk about microneedling here for just a second. So you can actually go to Walmart, I think, maybe CVS, I don't know. You can go on Amazon for sure, and you can buy what's called a dermal roller. So a dermal roller it's microneedling, so it has needles, and you literally take it and you puncture holes in the skin. But what happens is because it's a wheel, and you can imagine you have those needles going into the skin, and as the wheel pulls forward, it kind of lifts that skin up and pulls on, and it actually creates more of a traumatic effect than what we have, which is the radio frequency microneedling. It's kind of a stamp. It goes in, it stamps, it emits the radio frequency, and in fact, our machine is even more advanced than some of the other devices. For example, the Potenza, the Morpheus 8, the Virtue RF. There's a lot of different devices that are on the market, but what they do not have is what's called the gnaw effect. And the gnaw effect is, so for example, let's say I use the stamp and it goes into the skin. Where that energy is distributed along the long axis of the needle. So if I have a lot of heat at the top of the needle where it's penetrated through the skin, and then this part of the needle has heat, and that's sitting basically at the top of the skin, that can burn a hole in the skin, and it can leave these grid marks in the skin if using that device. And that's, for example, the Virtue does not have the gnaw effect, whereas the gnaw effect keeps all of the energy at the tip. So, and you can search this up. This is not hidden information. So all the energy is at the tip, and there's no energy at the top of the surface where the needle is going into the skin. There's no energy there. It's all concentrated down at the tip. And that energy is in a teardrop shape, so it covers more surface area. So as that energy is distributed, that tissue shrinks, and that's what causes the tightening without affecting the superficial surface or the epidermis layer of the skin. And so we don't see that grid mark that you'll see with microneedling. A lot of times you'll see a grid with regular microneedling because of the fact that they haven't really considered the distribution of the energy down the long axis of the needle. Keep in mind there's 25 needles in a grid. So every time I use the machine, I lay it down and 25 needles puncture the skin. But with the gnaw effect, I've mitigated the fact that I'm not going to leave a trace mark or a grid at that section of skin. It's all going to be down deeper, that's where we want the action to occur anyway. So if we look at the Morpheus 8, that is that one does not have the gnaw effect, and then you have monopolar and bipolar. There's a lot of science that goes into, and I've done all of my research. I selected the machine that I selected because I only want the very finest for my patients, and that's why we chose and went with the Silpherm X. There is another one called the Scarlet, which also does have the gnaw effect, and we do also have the Scarlet and the Silpherm X. So, but then you add on top of that, so that treats down deep in the skin, and then you add on top of that a Deca Smart Side laser, and that treats the surface of the skin. It treats any dark spots, red spots, So we've looked at. Plus, we add exosomes. There's a whole gamut. PRP. We can treat under eye bags with the Agnes. The Agnes is a whole separate device. We have all of the devices necessary to essentially do. I would say pretty much not replacing a facelift, but almost. With enough treatments, we can get these patients to have what we call a country club facelift, where they just they look rested. They don't look like they've been pulled and tugged and and have the big lips, and they just look rested and they look natural, and it works really well. And so if the RF microneedling it's truly a game changer, and it's relatively new technology. I mean, at least the gnaw effect, and as we get more and more advanced, it just gets better, and what we have is the best equipment you can buy right now.
Yeah, and we're excited to offer it.
Absolutely, yeah.
So how long are the treatments, and then what's the preparation for the treatments?
So the treatments are only about 45 minutes. Fortunately, because we have the ability to give you blocks, so I can give what's called an infraorbital block. By the way, I've had the Scarlet and I've had the Silpherm X and other treatments. So I know how painful they can be, because they can be painful. But with an infraorbital block, a supraorbital block, an infraalveolar nerve block, and with topical cream, and with the Pronox is a nitrous, with those three things, you do not feel a thing. And I can be very aggressive with the machine, because you want to be, it's a procedure. Like, you want to be aggressive to get good results. And the number of procedures necessary is based on, it's per decade. So if you're 40, you need 44 procedures. So it's about one procedure per decade. So if you're 30, you need about 3 procedures. If you're 50, you need 5. So just kind of as a rule of thumb. And then we space those out about every 6 weeks. So we'll do one procedure, and then you'll get a post-operative package. So you'll get all of the serums and exosomes and lotions and sunscreens, and we give you this package for post-treatment so that you can utilize that, brightening of the skin. We have a whole package that we give our patients after they go through the process in order to help maintain and stimulate that collagen. And so length of procedure is about 40 minutes, 45 minutes, and then after that, it's just maintenance at home. And these procedures, you can pretty much go to work the next day. You're a little bit red. You just looks like maybe you have a sunburn, Mm-hmm. But other than that, and the other beauty of RF is we can go right underneath the eye, literally right up to the eyelash, both upper and lower lids. And you can't do that with a laser. There's really no other machine that you can go that close to the eye and treat that area. Imagine the last time you had any sort of treatment, not that you would, but underneath your eye, and to treat that skin and to stimulate the collagen of that skin. So the fact that the RF can go so close to the eye, the reason that we're able to go so close to the eye is because we can go to 0.3 millimeters in depth, and so that's not a lot. So, and it goes up to 4 millimeters, but we can adjust the depth of the microneedling and it to 0.3 millimeters, and that's why we're able to go literally right to the eye. So let's say you have dark under eyes. With one treatment of the RF microneedling, I can eliminate those dark under eyes. Even a 30-year-old, right? And they're just barely starting to get, some of that dark under eyes, which the eyes and the teeth are what make us look old. And if we can treat those things, we can reverse age significantly. And then also eye bags, we can treat eye bags, which is it's a different device, same technique, but just a different way of managing it. So it's really cool stuff, and we're super excited. Now this is one of the machines that we've got. So this is the Silpherm X, and this is the one that is the RF microneedling. And we would start with the Silpherm, and of course we use topical anesthetic, Pronox, and intraoral blocks. And then this is the SmartSide Pro, the Deca SmartSide Pro, which is the laser. And those two devices, and that's a vacuum, so you have to vacuum the skin that is being treated because it emits a smell, and we can't have that going through the building. So, but these two devices can reverse like 15 years easily, which is pretty
and only
pretty
a couple
remarkable.
sessions, right?
Yeah, about 3
nice.
sessions. I mean, depends, maybe 4. And I'll do the assessment and kind of make the judgment call. We didn't even talk about Botox, and just doing neuromodulators, which, whether it's Dysport or Botox or whatever, which too, having all of these things at our disposal, plus doing a beautiful reconstruction with their teeth, now we are focusing on the face. That's really what we want to do. We want to focus on the face. We don't want to just stop at the teeth, because we can give you the most incredible, beautiful, functioning set of teeth, but the canvas that we're working with, which is your whole face, we want to maximize that as well. And I call it, you go to the dental hygienist and you get your teeth cleaned, which is dental hygiene. But, I call this facial hygiene. I mean, we all need to do facial hygiene. And it's not, for example, I would never pick up the phone and call a med spa and have schedule one of these procedures. But being that I'm, at the dental office, or I'm at a place that I have to go for whatever other procedure, and they have these devices, then I'm more inclined to, sign me up. I want to do this, because it truly makes such a big difference. And if I could do this on any one of us here, you would come running back saying, okay, I want to do it again, because you'll notice that big of a difference. It truly makes a huge difference. And it's really cool stuff. So
yeah, well, and you've experienced it for yourself, so you can testify your firsthand, and we'll talk more about it as we have more live streams. But that was great. You actually answered all the questions that we have from the last live stream. I think, do you have something to cover?
So here's a kind of pock marks, right? Somebody who's had severe acne and their skin is just irregular. The RF is so perfect for that. I mean, it literally just smooths everything out and gives them back that smooth look that, like, for example, this lady was very self-conscious about it, has just kind of dealt with it. And we see the same thing with our patients and their teeth, right? Like, they just accept the fact that their teeth are missing or broken or loose, or it's like, that's just the way it is. And a lot of times with our skin, same thing. We just accept the fact that our skin is the way it is. But there are treatments, just like in dentistry, there are treatments that we can do to really smooth things out and to make it more functional, more aesthetic, right? And so, I would encourage everybody. In fact, I'm willing to do one case on a person at a fraction of the price, just so they can try it, because I'm so convinced at the end result is incredible. And so
it is. But again, thank you, doctor. You covered all the questions, which was good, because this was all, like, how often is this recommended were the questions. You talked about the pain, and then we even showed some before and afters. No, and it's great. Like you said, we're putting out offers. We have the link for the website, and they can even download the app where they can see those offers. And there's even interest-free payments and all that stuff. But
if we go to the Repeat MD website, under Trust Implants, we do have, or Trust Wellness, we do have the Repeat MD application, which you can download and look at all the services. You can even buy the services on there, buy different packages. I'm not here to sell or promote anything. All I know is the stuff works. And if you have it done, you're going to want to keep doing it, because you're going to reverse that aging process. And actually, the more and more you do it, you're going to feel better, and ultimately that's what our end goal is. You know, when we do an RF case or when we do a full mouth reconstruction, at the end of the day, the patients feel better. They feel better about themselves. They have more self-confidence. They are, you know, they kind of feel like they can present themselves to the world. Whereas when they're, you know, in a state like this and their teeth are kind of all over the place and worn down and broken, like they don't know how to present themselves to the world, and they've just succumbed to the fact that, you know, this is just my new reality, right? But there are so many things that we can fix. We can fix this, you know, and we can fix, you know, melasma. We can fix dark spots. We can fix under eye bags. And a lot of times, especially guys, they're not inclined to schedule an appointment and go get their under eye bags fixed. It's just not part of our nature. I don't know that I would do it. But now that I have the Silfirm and the Agnes, I would do it because I know what it can do. So,
Doctor, that's why we market and target their wives as a 2-for-1 deal, because the wives are going to say, hey, you need this.
Plus, your wives will very much appreciate the fact that now your under eye bags are treated. So,
yeah.
But no, it's really cool stuff. And it's really not that expensive considering the return on investment, what you get, you know. So,
yeah, of course. Thank you, Doctor. Now let's go ahead and go over the case of the week.
Okay.
You know, speaking of restoring people's lives, their smiles.
Yeah. So this is a patient who had come in, you know, very similar situation that we talk about all the time. He'd come in, he'd gone to multiple offices, had been told that he is not a candidate for reconstruction. And I know why, because it's a lot of work for me to do the case, but I knew I would be successful in it. So, sorry, my phone is just blowing up right now, and I'm not sure why. But at the end of the day, so here's his CAT scan, okay? And now here, let's see. And if we were to look at, let me see if I can pull up his cross-sectional view of his CT. Hopefully I've got it here somewhere. Okay, here we go.
So how come they told him he's not a candidate?
So if you look, so if we look at this image here, this is a cross-sectional view. So down here, this is a tooth right here. This is the upper jaw, so the maxilla. And you'll notice here there's literally no bone. No bone whatsoever to place an implant. So we're talking maybe 3 millimeters of bone right here, okay? Plus the length. So I have to look at, when I'm doing a case like this, I have to look at the diameter, how much circumference I have of bone, and I also have to look at the length, how much volume or depth do I have. So in this case, I have no width and I have no height. And so I can see where a place like Clear Choice would look at this and say, not worth it. It's not in my wheelhouse, not worth the amount of time it's going to take, plus not having the skill set to know how to manage the case. So they would push him off and say, you know what, because there's a guy sitting right next to him that has a ton of bone and is a slam dunk case. I'm talking about in their waiting room. That it's like, not worth my time, right? You know. So, but once he came to me. Here's another cross-sectional view. Again, very, very little bone, if any. This is a tooth right here, but once that tooth is out, the amount of bone I'm left with is here. It's just zero bone whatsoever. Same thing on the bottom. Very little bone here. But now let's take a look at. First, I'm going to show the actual surgery because this was yesterday. This was, so what we're talking about is things that literally just happened. So I did what's called, well, actually, let me first go to the CT scan because we did, here's this CAT scan, and you'll notice this kind of a mesh here. It's like looks like a, I don't know, chicken wire or like a screen or something. And the angulation of these implants is because of bone positioning, and getting longer rigid fixation. I normally don't angle implants, but certain cases I will, only because of this situation. All right, so this is post-operative, so this was after this x-ray. So we pulled all the teeth out, did the bone grafts, did the sinus grafts, and then also did the tie mesh onlay graft. So now let's take a look at the surgery of me removing the mesh. And now we go back into, and we're talking about having faith and believing in God, that there's no reason that this should work. But a lot of times I ask the body to do things, and with a lot of faith, and it's a miracle to me that it actually works. So what I did was we build a titanium framework, a titanium base, and then I lay down autogenous bone, and we also use what's called bone morphogenetic protein, BMP, and we're rebuilding that ridge. You remember on those x-rays, I had little to no bone whatsoever in there. So I know this is kind of fast, but right now I'm removing the tie mesh. I'm taking it out, so the tie mesh is now out, and that's the piece that it separates the bone from the gum tissue. Okay, I know this is kind of a lot to watch, and here again we're just removing the tie mesh because that's what's going to allow that bone to form underneath. Because if you didn't have this titanium mesh, then the soft tissue would take over and turn that graft into a soft material. It would become very soft and it wouldn't work. So, and this is where, companies like ClearChoice would never even consider getting involved with this sort of a thing, because it's just way beyond their, again, they've got 5 patients waiting they don't have these problems, and they have plenty of bone, and it's a slam dunk case, And so, but here, take a look at this ridge. I mean, it is as hard and as solid and as could possibly be, and I've got a mile of bone here now. So not only was I able to regenerate the bone, now this patient is a candidate for implants. Whereas prior to doing this graft and regenerating the bone, he was not a candidate. He would not be able to have implants. And I'm not going to bore you with all this stuff, but at the end, and then I ended up placing a couple of additional implants in order to just give him that much more support, because, and I'm getting great torque. So I'm placing these implants in grafted bone, in grafted sinuses, and I'm getting 70 plus Newton centimeters of torque. So I'm getting a lot of torque in bone that we have just rebuilt. In his first surgery, so his first, the tie mesh was January 4th. And now we're just kind of closing everything up. So.
And yesterday was the placement of everything, and then they left with the partials?
He left with a denture. Yeah.
So what's next for this patient?
So the next thing is to just start finishing up his case and finishing up making the final set of teeth. And so,
okay.
But let me go back to, so we're kind of done looking at that video, but let's look at the actual image of, and I know it's a little graphic, but to me, this is such a beautiful sight. This is all regenerated hard bone. I mean, I've got 10 millimeters width. I've probably got 14 millimeters in height. And remember, I had like 3 millimeters of width and, I don't know, maybe 4 millimeters of height. So we were able to regenerate the entire maxilla, and now this patient is now a candidate for having a good, solid, long-term fixed implant prosthesis. So, and it's just, I love the fact that we know how to do this. We have the materials on how to do this, and in the end, very successful. And more importantly, I love the fact that we now, once this case is done and he has his permanent, beautiful set of teeth, that we can now focus on outside the mouth and treat the skin, because he's got some eye bags that we're going to treat, skin resurfacing. So it just adds to the overall effect of what we're doing here. It just maximizes so that when patients come to us, they are getting a service that literally just does not exist really anywhere else. And for that, it's, I'm grateful that we are able to do that and that we have all of these tools at our disposal to improve the lives of every single one of our patients as they go through the process.
Yeah, that's awesome, Doctor. Thank you. And like you said, the fact that we can do those type of cases here is kind of unique, because there's plenty of places all over the country, even the world, that would turn cases like that down. They won't even touch them, like you said. So yeah, that's awesome. But I'd like to have like a short 60-second break, 1 minute break, just a water break, and then we can go over the video of Dr. Huberman that we were talking about last week. I know there's a few questions that I have here for you. We can.
For more than 20 years, we've been the #1 choice in Southern California for dental implants, thanks to Dr. John Willardsen, our founder. We're experts at making dental implants that fit you perfectly using the best materials. Don't be let down by false promises elsewhere. With us, you're choosing dependable, top-notch care. Start your journey.
For over 2 decades, Trust Implants has led the way in dental implant technology in Southern California. Founded by Dr. John Willardsen, our clinic has transformed smiles with thousands of successful procedures. We prioritize premium quality and a tailored approach for each patient. At Trust Implants, we deliver on our promises, ensuring unmatched results and the highest satisfaction. Rediscover your smile and confidence with us. Schedule a free consultation, in person or virtually.
So, like we mentioned last week, we talked about the Dr. Huberman video, which I actually watched, and he's actually been coming out with a lot more oral health videos lately.
I've noticed that this week.
Yeah, he added the 7th pillar for optimal lifestyle, and he's been bringing people on for the oral health and all that. But because I know he talked about some daily routines to do. Mm-hmm. From your experience, I mean, you see the worst end of when people don't take care of their mouths. What is a daily routine that you recommend, like a must do every day, and then also as far as like cleanings and things like that?
Yeah, so a daily routine, just brush your teeth, and I come at that with a bit of a bias, because usually the cases that we see, they just haven't done that. I mean, they're at the point of it's complete and utter loss, I guess. The patients, by the time they get to me, we're talking about this sort of thing where this is obviously he hasn't brushed, and I've shown this 1,000 times, so sorry to keep showing the same photo, but it demonstrates the fact of complete just giving up. And in reality, I don't even blame the patient. I don't blame him. I just blame I would say it's just a lack of understanding, a lack of knowledge. It could be just a psychological thing where they've just simply given up on life in general. And their teeth a lot of times are the first thing that they give up on. They don't feel great about themselves. They don't feel great about their teeth. And so they get to the point to where it's kind of like, what's the point? What's the point of brushing? What's the point of flossing? What's the point of, washing my face? I mean, what's the point of, I hope that everybody takes a shower, but I know that people get to the point where they're like, what's the point of even taking a shower? And in reality, that's a psychological thing. And that's where, you just don't ever want to get to the point where have given up so much. You've just given up so much meaning given up on life, that you just don't care about your overall health. Because yesterday I was listening to a podcast, and You can, in life, for example, you can lose, and I've personally lost a lot of things. You can lose money, you can lose your home, you can lose your car, you can lose your business, you can lose your spouse, you can lose your girlfriend, you can lose a child. And all of those things are a travesty. Like, yeah, any single one of those things, the thought of losing would be, it's a lot of times more than you can bear. And oftentimes these patients have lost a lot. And so because they've lost so much, a lot of times they just give up. But the one thing that if they lose, they're gonna pay dearly, and that is losing their health. And we see this with our patients, because we have patients that have different ailments, different diseases that they have to deal with on a minute by minute basis. It's all consuming. I'm thinking of a few patients in my mind right now. So it's all consuming. Every day is spent going to the doctor, getting prescriptions, dealing with their ailment, whatever it may be, on a moment by moment basis. It consumes everything. It consumes everything. And at the end of the day, because of that ailment, because of their now, the sickness that they're having to deal with, they start losing family members, friends, their houses, cars, their business. And so treating our health with respect and recognizing how important it is, we take it for granted. A lot of times we take for granted the fact that, I feel pretty healthy. I can go for a bike ride. I come home. I'm not winded. I can go for a run. I can go to the gym. I don't really think about my health too much, but heaven forbid something happens to where I have to deal with some ailment or some disease on a moment by moment basis. So, I kind of diverge a little bit, but the mouth is a true representation of something more that's going on. As we look at this picture, there's something more that's going on here. It's not just the fact that this looks awful. It's not just the fact that he has raging infection, raging tartar, debris, calculus. There is a much, much bigger back end story, and I don't know necessarily what that story is that's happening here. So a lot of times we have to deal with whatever that back end story is, and then help the patient understand, taking care of your teeth, taking care of your health, taking care of your mind, taking care of your body, exercising, drinking enough water, living the life of, David Goggins and Andrew Huberman or whoever. These are all beneficial things that help us in the long run to live much fulfilled lives, maintain our relationships, maintain our financial status, or not status, but maintain a level of financial abilities, and not just giving up and just losing everything. And so, when I look at this picture, to me, it's kind of the beginning of a snowball effect of just completely giving up. And that's here on this podcast. If there's anything we can do to help patients to just not give up, that's why when we start our podcast, we talk about our Lord and Savior Jesus Christ. We talk about God. We talk about, there is hope, even though right now in the world it feels so heavy. It feels so like I just want to give up, because there is just so much going on, and our lives get crazy. And oftentimes we need help. Like, we need that extra push to help us to live, somewhat of a fulfilled life, and not let our health, go down the drain. Because once that happens, it's a very difficult road. I'm thinking of a patient right now who he deals with ankylosing spondylitis, and how the guy moves around. His feet are so swollen. Every movement, every motion that he takes is an effort. He does not live life effortlessly. Everything that he does takes a ton of effort, way more than what it takes us on our end here. So,
yeah, awesome. Thank you, Doctor. Well, I think that's it for this week. We covered quite a bit, but I think it was all great stuff, talking about like the whole vision, the purpose of Trust Implants and Trust Aesthetics, because like you said, it starts with the smile, but then it's the rest, right? It's the entire face. Like we said, it's the first thing that people look at. Your smile in your eyes, and then they go from there. And you can tell, you can really tell, is like when you're looking at or talking with someone, is where their eyes are going towards. And then if you even get complimented by them, your whole
it helps.
It helps, yeah. Like your
Absolutely.
whole frequency that you radiate, it helps, right? You're happier, you're better, you're more confident. So that's kind of the point.
And I love that the idea of the frequency. If we look at a person like this, right? I mean, beautiful skin, beautiful teeth, beautiful eyes. The frequency that she's putting off is very from a picture. Maybe in person is different, who knows. But, not that we all have to have this level of beauty, but there's a lot of things that we can do so that we put our best face forward. And maintaining our teeth and our mouths, our skin, our face, and doing everything we can to try to help put our best face forward is an investment that is invaluable. And then also to maintain our overall health. Those things are critically important. And the more time, effort, and energy we spend on, and it doesn't take a lot of time, it just takes a little bit of effort. And that little bit of effort, it goes a long ways.
Of course. Thank you. And we want to thank all of our viewers who've jumped in and out of the stream, because I've been watching it and we've had, fluctuations, but thanks for watching, and always thanks for commenting. These comments help for next live stream, and it's perfect that we leave it up for about a week. But is there something you'd like to end with, Doctor?
No, again, thank you, Memo, for all your hard work. And also thank you to our viewers for, supporting us and, liking, subscribing, and applying these principles. It's important that we try to live our best lives, think about those things that maybe you are or maybe are not doing. And this week, make a goal to try to, adopt or apply something that that would help you, that would be beneficial. And try it for a week. I think, Memo, you were saying, it takes about 3 weeks to make it a habit, right? So start developing habits that will help you, your overall life improve, so that, we can have these, have good, positive, elevate our frequencies, have good, positive attitudes, and just live life to the fullest. I'm Dr. Willardsen here with Memo Gea, Trust Implants, trustimplants.com. Thank you guys for watching. Again, we apologize for the late start, but we are just grateful for each of you, for our viewers, and for those who are supporting us.